Good morning. Thanks for being with me today, June 24th, 2020. This is my COVID-19 world update, and I'm going to share a little theory on dissemination, maybe to answer some questions. So this here is a map of the contiguous United States, and it also shows in blue lines the interstate highway system. Now, I travel quite a lot for work, and in traveling, most of it is flying. So I was thinking about the spread of the coronavirus and how that works. So I'm going to just take you through something to kind of show in my mind why it is that I think that some places are more affected than others, beyond the population density thing, but more looking at the capacity of a place to receive a new infection. Now, the airline that I fly with the most has, 4 major hubs in the U.S. They've got one in Phoenix, they've got one in Dallas, they've got one in Chicago, and they've got one in Philadelphia. And all of these hubs have flights that fly to each other. Right? And then they have minor hubs, Miami, for example, Houston, for example, Los Angeles, San Francisco, Seattle area, Boston, Denver. Okay? And those minor hubs also fly everywhere, that often to each other, but mostly to the major hubs. So if we think about the virus coming in from overseas, where it's arriving at one of these international hubs, right, then the way that it's going to spread is in the communities where there is a hub first, and then to the communities that have flights from the hub. Okay. Now, that's not all of the cities that these airlines fly to. This particular airline, for example, will take a flight from Phoenix to Salt Lake City. They'll take this flight from Dallas to Houston. They'll take a flight from Houston to Birmingham, and so on and so forth. So you can see that the way the system works, large number of travelers traveling between large airports, and it disseminates down to smaller and smaller airports and hubs, right? So let's say, for example, that you live in this little area here in the southwest of the state of Utah. On the airline that I fly on, there is no flight that gets to that spot. So if you're going to go there, you're going to have to fly in and then rent a car and drive or take a bus. So what ends up happening is that it's sort of the reverse of a river system, where you start with a little trickle of water, it turns into a stream, the stream turns into a creek, the creek turns into a tributary river, and then the tributary river turns into a major river. But what we're looking at is the reverse. We've got a major river that's then flowing backwards into the smaller areas. So, for example, if you're literally here in Flyover, Illinois, where the nearest reasonable sized airport, for example, would be Champaign, Urbana, you're likely not to see very many cases yet in your county. If you're in eastern Idaho, for example, there's an airport, but it's a small airport. And just the fact that you're not going to have as many travelers, you're not going to see as many cases. Now, I'm not saying that the coronavirus spreads by air travel, though it does spread by air travel. It spreads by personal contact, human to human. But if there are fewer humans from, say, San Francisco as a hotspot, or New York City is a hot spot, that end up transported miraculously to southwest South Dakota, there won't be transmission. So I had a friend of mine essentially say that coronavirus is no big deal because he didn't have any cases in his local community. And the purpose of this discussion was to try to show, in my mind, why that is. So going on to the data, another friend asked me if I believed that the lower case counts in South Korea that they've achieved have been due to a lower rate of testing. So I brought up this graph, which is a 7-day rolling average, which I don't like, but I forgot to click off the 7-day rolling average. Sorry about that. Of the daily COVID-19 tests in South Korea. And this graph goes from March 3rd to June 23rd. So it's one of the long graphs. Also, I didn't truncate it to 30 days because I wanted to look back quite a ways to see, well, has it changed? And it looks like today they are testing more than they were 3 months ago. So the decreased case rate in South Korea is not because they stopped testing. This also is South Korea, and this is daily new confirmed COVID-19 cases. I heard some somewhat breathless reporting in the media about South Korea resurgence, but that's 2 upward data points there. I'm not sure I'd call that a resurgence. Perhaps you could get a line like that if you looked at it. So I'm not buying that South Korea is seeing a resurgence yet. This now is to the Philippines. An engineer friend of mine moved back there several years ago, and he said that he's not getting good information from his news sources, and asked me if I could do an update on the Philippines. And Philippines looks like during their lockdown period, again, this is May 26th to June 24th, so that's a 30-day chart. And the first red line that I drew on there, that was the lockdown period in the Philippines, and they definitely were reducing the spread, but they have started opening up to a certain extent now, in that multiple people in a family are allowed on to the street to go buy food, etc. So the streets are getting crowded again, and I imagine also due to the fact that many people in the Philippines earn the money to buy food to eat each individual given day. So if they stop working, they start starving. So that's also an understanding. You can only go so long locked in a society like the Philippines without desperation setting in. People are going to have to go out. So we'll keep an eye on that. Now, this is testing in the Philippines, because some people have said also that the Philippines has relatively low case counts because they have a low testing rate. So this is comparing for the last 30 days the testing that's been done in South Korea on a daily basis versus the testing that's been done in the Philippines on a daily basis. And you can see that they do test more in South Korea on almost every given day, but there are places where they coincide. And again, remember, this chart is per 1,000 people. So in other words, it's a testing rate among the population. And this is deaths, comparing new COVID deaths in the Philippines and new COVID deaths in South Korea. You can definitely see, at least at the end of this chart, what I call the Sunday effect, where you've got a 7-day cyclic going on there with the deaths. But I still like to look at it on a daily basis, because I don't like hiding things in the 7-day rolling average. In South Korea, it is good news in that their daily deaths are bumping off of 0. That's where we need to get to, so that's good. And then now we're adding the United States, just so that you can see the comparison about where we stand in the United States versus the Philippines and South Korea, which we already looked at on other slides. Again, this is a 30-day slide, and there is definitely an uptrend in daily new cases. And again, this is eliminating the population differences. This is cases per million people over the last 30 days. So while the United States was on a good lockdown, we were keeping our daily new cases pretty close to steady. Since there's a 7 to 15 day window, whatever happened on or about June the 9th in our society is what likely has caused the steady uptrend that started from there. This then is testing per 100,000 people, and you can see that the U.S. per capita is testing at a significantly higher rate than even South Korea. Looks like 6 to 7 times, a factor of 6 or 7 times as many tests are being performed in the United States than in South Korea. So that may also explain the higher case rate in the U.S. in part. However, as the testing, you can see a trend that the testing per capita is increasing in the United States. But if we go back to the prior slide, you can see that it's nothing like the massive upswing in the cases. So you can't, it doesn't correlate between testing and cases. That's my update for the day. Thank you so much for watching. I do appreciate it. I appreciate the questions that came from friends and family as well. Still looking for a comment from a viewer, so we'll see if we get any of those. Have a good day. Stay safe. Wear a mask. Masks are our friends right now when you're in public and you can't be socially distanced. Wear a mask if you care at all about saving a life. May not be your life, but if you care about humans, if you care about people, wear a mask. Thanks very much.